Got it.
yenn saay sama xel dem ci nit ñu baax ñamu séqaloo ngir mënu fàtte ki la yaataloon ki la ma yoo on nous jamais yeah. Yenn saay ci sama bésu neex sama xel dem ca fama jóge woo yenn saay sama xel dem ci nit ñu baax ñamu séqaloo ngir mënu fàtte ki la yaataloon ki la ma yoo.
Good afternoon, everybody. My name is Marietjie de Villiers. I'm the coordinator for the Stripe COVID program for AFREhealth. I'm from Cape Town, South Africa, and it's my pleasure to welcome you this afternoon to this webinar on post-COVID condition and the COVID modules training that we will do. So this is the second in a series of the Stripe COVID webinars. We will outline the new Stripe module developed on post-COVID condition, also known as long COVID. This module is also now the 20th module in the Stripe series. 17 HIV modules, and this is the third COVID model, gives us a lovely total of 20 modules. The webinar will provide an overview of the exciting COVID training course, which will include all three modules, starting on Monday, 18 April 2022. I just want to announce that unfortunately, the interpreter was not available for today to translate into French. I do apologize to the French-speaking participants for that. We tried our best, but the person could not be available. So please contact Roger afterwards if you would like some maybe translations of the slides or any of the material. We will have 3 speakers today, and I want to thank our partners, University of California, San Francisco, who will be the speakers for today and who have really been a wonderful partner with AFREhealth in this project. So I would like to first introduce Professor David Sears. He's an associate professor at UCSF in the Division of Infectious Diseases, where he provides HIV primary care and work on the inpatient infectious diseases consultation service. His main interest is in medical education. That's why it's wonderful that you are here today, David. And he has been working actively with Stripe to help develop and refine all these modules over the last 2.5 years. David will be introducing the other 2 speakers, Rand and Maeve, and the speakers will follow on each other without additional introduction during the program. Dave, welcome, and then Thank you so much for being here. I just want to acknowledge Dr. Mike Reid, who is also here, still on vacation. Thank you for joining us, Mike. And Deborah von Zinkenagel, which is also our senior partner from UCSF. Thank you, Dave. Over to you.
Great. Thank you so much, Marietjie, for the nice introduction. Thank you, everybody, for joining today. I'm going to be on very briefly before turning it over to Reid Dadasovich. But before doing so, just wanted to, again, thank everyone. I know your time is really valuable, and the pandemic has thrown us so many challenges over the last couple of years, and we're just incredibly grateful for your partnership and for all of the work that everyone on this call has done to care for our patients and to advance our medical education mission. So thank you so much, and thank you for joining today. Our agenda is pretty straightforward. As Marietjie was saying, I'm going to hand it over to Dr. Reid Dadasovich in just a moment. We'll be reviewing the post-COVID syndrome module, and then when Rand finishes, we'll turn it over to Maeve Forster, who will speak briefly about a UCSF-led COVID training program that will be coming up later this month. And after Maeve finishes, then I think we'll have time for questions, comments, feedback with regard to the information that Rand will be presenting. So many of you, I think, may know Rand from previous meetings, but just by way of a quick introduction, Rand is an infectious diseases fellow. He's just finishing up his fellowship, which is his subspecialty training in infectious diseases. And he has been working with Stripe over the last year, also to help develop these modules, particularly the new COVID modules that we've created, and also has worked on refining some of the other prior HIV modules as well. Rand also has primary interest in medical education. I've been very fortunate to work with him here in our HIV clinic for a couple of years, and now on Stripe in the last year. So I will turn it over to Rand, who will introduce module 20, and then we'll go to Maeve and then bring it back for questions at the end. Thank you.
Great. Thank you so much, David. Good afternoon, good evening, everyone. It's exciting to be here with you all today to share Module 20, which is our module focusing on post-COVID condition, aka long COVID, which is a term you may be more familiar with. Let me go ahead and share my screen so I can walk you through the module. Okay. So learners will open up the online platform, and this should look familiar to any of you who've gone through any of the Stripe modules in the past, but just to kind of walk you through, there's a section up front for announcements and questions and answers, and then really getting into the roadmap for this module. So again, this is the post-COVID condition module. We're using that phrase because that's what the WHO has decided to use, but learners may be more familiar with other phrases, including post-acute sequelae of COVID, or PACS, or long COVID. These are all synonyms. But again, we're using PCC, or post-COVID condition, for this module. Like our other modules, this module is really anchored on the case of a patient, a participant. So this is a 46-year-old man, Daniel, and I'll walk you through the module. We also meet some of his family members as well, and kind of go through some of the common presentations and questions around PCC. So a familiar roadmap, learners will start with a pre-knowledge quiz, which they should all complete before moving on to the interactive self-paced module. We have designed this, like our other modules, to go along with a multidisciplinary discussion and role play that will be done via Zoom, led by local facilitators, which we really think, especially for this module, will help to enrich sort of the material and to allow for multidisciplinary kind of collaboration, interprofessional learning. And then at the completion of that, learners will be asked to complete a post-knowledge quiz. So there are links to each of those activities below, including a learner handout for Zoom. Let me go ahead and click on the module itself so I can walk you through that. Okay, so here we are inside the module, post-COVID condition. And let me scan up to the top. For whatever reason, it's not doing that. Okay, I'm back at the top. So the overall goal of this module is to understand the clinical presentation and psychosocial PC and the other clinical sequelae of COVID objectives. The first is to compare and contrast COVID-19, and 2, to describe the clinical presentation and possible pathogenesis of PCC. So why does PCC happen in some patients and not others? There's still a lot that we don't understand, but we'll go through some of the hypotheses. Learning objective 3 is to describe a multidisciplinary approach to the care of a patient who presents with ongoing symptoms after recent COVID infection. 4, to apply a patient-centered approach to the evaluation and treatment of patients who present after COVID-19 infection. And finally, 5, to discuss the psychosocial impact of PCC on patients, their families, and communities. Okay, so jumping in to Daniel. So he's a 46-year-old man. He comes to your clinic with ongoing fatigue. 3 months ago, he had fever, cough, and body aches and was diagnosed with COVID-19. His other symptoms improved, luckily, but his fatigue has continued. And so we introduced learners to some of the terminology and background about post-COVID condition, beginning with sort of how it was described early on in the pandemic and how we've eventually come up with some definitions, and the WHO has defined PCC in a very specific way, which we link to. But we introduced some kind of simple definitions for learners. Acute COVID-19 is defined as signs and symptoms of COVID that last up to 4 weeks. Ongoing symptomatic COVID-19 are symptoms that last from 4 to 12 weeks after COVID-19 diagnosis or onset of symptoms. And then post-COVID condition is really signs and symptoms that persist beyond 12 weeks and cannot be explained by alternative diagnosis. And again, learners can link to the WHO clinical case definition of post-COVID condition. We then move on to a sorting activity where learners will be asked, given kind of clinical prompts, short descriptions, and then asked to sort these into 3 buckets. And sorry if my screen is not showing this fully. But essentially they'll read a prompt and then sort it into one of 3 buckets, whether it fits best with acute COVID-19, ongoing symptomatic COVID-19, or post-COVID condition. There are 4 case prompts, and then they'll move on to the next lesson. All right, so in the next section, we return to the case. So we learn a little bit more about Daniel's history of COVID-19 and his ongoing fatigue. You explained to him that there are many causes of fatigue and that obtaining further history in an exam will help you determine if his symptoms are related to COVID-19. And the patient is asking, his sister had COVID-19, but she has recovered. She doesn't have any persistent symptoms. And he's asking why does he still have symptoms when his sister is fully recovered? So learners are then asked a multiple choice question about what symptoms are commonly associated with post-COVID condition. So I'll just answer here and then we can move on. Okay. As you can and I realized I skipped the section after the case prompt. So before the multiple choice question, we do give patients more information about the symptoms of PCC, as well as the diagnosis of PCC. Again, it's a clinical diagnosis, so no laboratory test is required. It's really based on kind of a holistic assessment of a patient, making sure to rule out other common causes of their symptoms, such as fatigue. And then we share a little bit about what's known around post-COVID condition, and the hypotheses as to its pathogenesis or its cause. And we do link to a paper in Nature, which goes through some of the possible mechanisms of post-COVID condition, which may be more relevant to the clinicians in the audience. And then we remind learners that really this idea of persistent symptoms after a severe viral infection is not unique to COVID, and that we have seen examples from other respiratory illnesses and respiratory viruses, including severe flu, RSV, and the other coronavirus infections like SARS and MERS. And we link to a fact sheet as well. All right, so then the learners would go on and complete that multiple choice question before moving on to the next section. All right, so the next section, we're really focusing on multidisciplinary care for post-COVID condition. We want learners to take a few minutes to think on their own to describe a multidisciplinary approach. So let's go through that. So as the case continues, Daniel tells you more about his fatigue. He says he's never felt this tired. Some days are better than others. Sometimes he has trouble getting out of bed. He's had to miss many days of work. When he has gone to work, he's had to take frequent breaks. And due to the days he's missed, he's bringing home less money than he used to, and he hasn't been able to give money to his family like he usually does. And so we really want learners to think about how they would evaluate post-COVID condition from whatever perspective happens to be their discipline. And so this is an opportunity for them to kind of jot down some of their own thoughts to the following questions. What are some conditions that would explain Daniel's fatigue? And how would you approach your initial evaluation of his symptoms? What aspects of his care would you focus on? So learners will submit their response. And then this is really the time when learners come together in small groups on the Zoom interactive sessions to share some of their thoughts and to hear perspectives from colleagues who may work in different disciplines in the healthcare setting. So our case does continue. So after a thorough history, physical exam, and laboratory testing, you complete your initial evaluation of Daniel's fatigue to rule out common conditions like anemia or depression. You meet with Daniel again the next week to explain that his test results are normal. And you explain that his symptoms are likely due to post-COVID condition. So the next section, we really want to focus on communication skills and how communicating around post-COVID condition may be different than communicating around some other syndromes or illnesses, particularly because there may be a lot of stigma around post-COVID condition and a lot is still unknown about this illness. So we want learners to reflect on what communication skills are important when interacting with a patient who presents with symptoms that might represent post-COVID condition. How might these visits be different than other clinical encounters? So we're asking learners to again reflect in a few sentences on how they might approach this and what they believe are important communication skills, how they would approach this case, and how this might be different than other clinical cases that they encounter. So learners will again submit their answer, and then we're hoping that they'll bring their thoughts and reflections again to the small group setting. Okay, so we'll move on to lesson 5, which is patient-centered care for post-COVID condition. And again, the objective here is to apply a patient-centered approach to the evaluation and treatment of patients who present after COVID infection. So now we meet Daniel's 17-year-old niece, Grace, and she presents to clinic. She had COVID 4 months ago. Recently, though, she's had trouble sleeping. She's been unable to concentrate on her schoolwork. She previously enjoyed going to school, but lately she's really been dreading it. Usually she gets top marks, but lately her grades have been slipping due to difficulty concentrating. She heard from her uncle, Daniel, that you, the healthcare provider, you think his fatigue could be a symptom of post-COVID condition, and she wonders if she could have it too. So Grace asks if her trouble concentrating might be related to COVID-19. So again, we're asking learners to reflect in 2 to 3 sentences how you might respond to Grace's question, and what steps could you take to evaluate her symptoms. So we're asking learners to reflect here. And then we move on to kind of a framework for patient-centered care. And this is using the OARS model. So we introduce patients to this acronym OARS. And this is a model for communicating with patients around difficult topics, including topics like post-COVID condition that, again, are poorly understood. And there aren't particular tests for post-COVID condition. And so there may be kind of novel, perspectives that come into play here from both the healthcare provider and from patients. So OARS stands for open questions, affirmations, reflective listening, and summarizing. And it's really an acronym that can remind healthcare providers and clinicians to demonstrate empathy and build trust with patients. And so we link to a worksheet to give learners more information about this acronym, about OARS. So in our next section, we're going to ask learners to actually exercise using OARS for one of our cases. So our case continues. This is Grace, our 17-year-old. You discuss post-COVID condition with her. She appears increasingly concerned. She wants to know, could she still be contagious? Could she pass on her infection if this is related to COVID? Or her difficulty concentrating, is that something that could affect her friends and family? So learners are asked a true-false question about post-COVID condition. And then we ask learners to really reflect on the psychosocial impacts of post-COVID condition. So, thinking about the impacts, not only on the individual, but also on, the community, family. So learners are asked to reflect in 2 to 3 sentences about, social impacts that they may have seen, they may have experienced, or what they may imagine, Grace could be experiencing in this case. And then again, we hope that learners are able to take these reflections and thoughts and come back together with other learners in a kind of interdisciplinary format to share their feelings. So we're at the end now of module 20. Just to review our objectives, we had 5 of them, and we took learners through the case of Daniel and then his niece Grace to kind of walk through these various objectives. So learners, after they complete this, will exit the course, and then to go back, let's see if I can go back. Well, I've lost it here, but from our main page, you'll remember that learners will be asked to complete a post activity quiz as well. So maybe at this point, I'll turn it back over to Maeve and we can do a Q&A. Happy to take any questions or feedback from folks.
Hi, thank you, Rand. Hi, everyone. My name is Maeve Forster. I use she, her pronouns. And I am one of the program managers for Stripe. So I wanted to just give you a brief introduction or advertise for a COVID-19 training course that our team, our UCSF team, so David and Rand and Mike and others, will be hosting at the end of April, just in case you had any learners who would like to go through these modules. I'm going to share some slides real quick. So here's just a brief overview. There we go. Okay. So first, we're going to cover 3 of the COVID modules that we've developed. So this is module 18, preparing for and managing patients with COVID-19. Module 19, COVID-19 vaccines and vaccine hesitancy. And then module 20, which Rand just went through here on post-COVID-19 condition. Per the usual Stripe format that you probably have seen in previous modules, they'll all employ the same approach of using case-based and team-based learning principles, trying to be very learner-centered and available on the LMS, which hopefully helps, support learner access. As Rand identified, all modules will include required pre-activities, so doing self-study activities, completing a pre-knowledge quiz, and then attending a Zoom session where everyone can work together through a couple of activities, and then a post-knowledge quiz as well. Our schedule will start in just a couple of weeks. So we'll have a first kickoff meeting on Tuesday, April 19th. This is a meeting where we'll just ensure that everyone has access to the LMS, knows how to use it, and just kind of go through the schedule and let them know what they need to do. There'll be a brief office hour on that Thursday morning as well, in case learners have any questions or need any additional support. And then we'll start training the following week on Tuesday, April 26th. We'll run through each module once a day. So one on Tuesday, 19 on Wednesday, and module 20 on Thursday. And then have a final meeting on Friday where we can just kind of review what hopefully they learned and gather any feedback that they might have for us or the modules or Stripe or what have you. They'll all occur at just about the same time to try to keep it consistent so it's easy for them to keep a schedule with everything else they probably have going on. There is a brief registration link I would like to ask everyone to use. Just has a couple of questions just so we can gather some initial information and understand the demographics of the learners we'll be supporting. So they can just use this link, answer a couple of questions, should take about 5 minutes. It'd be great if I could get registrations by next Monday, April 11th, but I can give a couple extra days if people need it as well. And then if anyone has any questions, they should feel free to reach out to me, or you can ask them in the Q&A right now. And I can send out, I can send these slides as well as a kind of more in-depth agenda to AFREhealth for them to send out in response to this webinar if you would like that additional information. So that is all I had. Marietjie, should I hand it back to you?
Thank you. Yes, thank you, David, Rand, and Maeve. Very much appreciate that. Now we would like people to ask questions so that we can have a lovely discussion. You can also put questions in the chat. Georgina is asking in the chat to post the registration link here. Well, you can just unmute yourself and ask your question, or you can raise your hand. Maybe I can start by asking Georgina, how can we market this course more widely or more intensively, because we're a bit disappointed we don't have many people on the webinar today. So I think we would need to do more to advertise it, because it seems to be quite a wonderful course. I don't know, Georgina, if you have a marketing plan.
Yeah, Marietjie, are you referring to the course that we're going to run from next 2 weeks? From which Maeve just talked about. All right, so we're going to have the flyer, which we're going to circulate through out to the community, and then also ask people to share with their networks as well. And I'm sure that we'll get more people registering for that. So once we have the link, that will be shared our community. And we'll also post it on our website and our social media platforms. So once we get that done, I'm sure that we'll get a lot of people attending. But really, if you remember at the last webinar, people were expecting that. They thought the program was meant for everyone, but we made them aware that we were starting first with the 3 vendor schools, and then we'll get back to them. So I'm sure there are a lot of people who are waiting for us. Once it is shared, they will join. Thank you, Marietjie.
Okay, thanks, Georgina. Something else in the chat, the registration. Okay. So I see Midian from Zimbabwe is on. Midian, how would you suggest that we get the course out to everybody who's interested? I can ask you a question. Okay. Any questions, other questions? You're welcome to ask some content questions about post-COVID syndrome also. You have the experts in the room, not only about the course, but the condition itself. I see the questions are slow. I wonder if I can ask David just to give us an overview of your experience with managing post-COVID syndrome. Just a few pointers or what you've experienced and how you are doing it.
Sure. Yeah, this is a really challenging topic, and I've had a number of patients in my clinic whom I'm their primary care provider who've had COVID, and a small fraction of them have still reported symptoms afterwards. And I think much of that has been ongoing fatigue. I mean, this is now a small number of patients. And I think one of the most important things which Rand was touching on is, at least in the evaluation, is we unfortunately don't have a diagnostic test that says, yes, this is post-COVID condition, and so it really requires a comprehensive evaluation of other things that may be leading to the patient's symptoms that they have after COVID infection. And that's occasionally involves laboratory testing for other things, certainly involves a very thorough history and physical exam. And we end up kind of settling potentially on a diagnosis of post-COVID condition if those symptoms have really started following a COVID infection, and if you've excluded other potential causes. I think the challenging thing for patients, or what I found most challenging then, is trying to counsel them on what to expect and what we know about the condition, because this is incredibly new and it's very much a developing field, and it's not something that we have clear treatment for. Nor do we have, and I think the module gets into this to some degree, nor do we have a great explanation for why or how this process is happening, what the pathophysiology is. There's a lot of interesting research in that area and a number of proposed mechanisms. And I think as a scientific community, we have to understand that better before we can hopefully figure out better treatment approaches and strategies. So a lot of times it's, I think what so many of us do in our day-to-day interactions with patients, which is being thorough, looking for potential causes of symptoms, validating symptoms that people are feeling, supporting them, telling them that, that for many people, the post-COVID condition symptoms will get better with time, and that we as a scientific community are learning more about this and about the right approaches for this. But it's just like everything that the pandemic has thrown at us over the last couple of years, we're very much learning on the fly, and it's challenging. And so many people have been infected that the sheer numbers of individuals who are going to have prolonged symptoms is going to be high.
Thanks, David. I wonder
And if
I
anybody else has experience or insights on how they approach it, I would love to hear that as well.
Yeah, thank you for that. I wondered if I can ask Rand, in AFREhealth, our emphasis is very much on interprofessional education and interprofessional practice and service. Maybe you can talk about the elements in this module that will help people to apply an interprofessional approach to this condition.
Yeah, sure. I think the activity is nice in that it really is meeting learners where they are. So regardless of what role they play in the healthcare team. Really want them to approach the case like they would in their daily work lives. And then really the Zoom activities is the chance for them to come together and learn about the perspectives of other members of the healthcare team in really an interdisciplinary format. And so whether it's a social worker on the team or a pharmacist or a nurse, a physician, I think that there's a lot to be gained from kind of hearing the perspective of others, and then stepping outside of our roles as healthcare workers, also just as community members ourselves, maybe having friends or family or even personal experiences with COVID or post-COVID condition. I think this is really the chance in these Zoom sessions to hear about the experiences of others, to learn about the experiences of different communities, all through the lens of kind of that multidisciplinary interprofessional healthcare team as well.
Thanks so much, Rand. Any questions? We have a quiet audience today, or maybe a satisfied audience. Okay. I don't see any hands. Any voices?
And I
Yeah,
will
there's-
add just one thing, excuse me, Rick. As the module gets rolled out and as all of you gain more familiarity with it, we of course would love to hear thoughts, comments, feedback around what is going well, what isn't going well, what you suggest we may want to change in future versions. I recognize it can be hard to take in a module and kind of a rapid fire presentation and immediately give thoughts and feedback, but please don't hesitate to reach out to any of us to share your experiences.
Great, thank you so much. Okay, so maybe we can have an early day then. I'm going to ask Georgina, Georgina Yabo is the Executive Director of AFREhealth. If you want, just on behalf of AFREhealth, have a final message for us.
All right, before I come and I give the final message, Dave, I want to find out, are there any enrollment conditions for those who will be joining the course? For some courses, when you join, there are certain conditions. Once you register, maybe you cannot miss any of the lectures. You need to have this. So if that could also be highlighted for us.
Yeah, actually, really good question, Georgina. Thanks for bringing that up. We don't have any requirements as to the participants. We just will have a limited number of seats. So as long as you register and you're not member number 200, we'll probably have a seat for you. So people will need to be able to access the LMS. So they might need, I don't know if it's a phone or a tablet or a computer or whatever technology that they prefer. And then they will be able to need to attend Zoom sessions a couple days a week. So they'll need to be able to have the bandwidth to be able to support that and attend.
Do you have to be an AFREhealth member to access, or if you are a non-AFREhealth member, you can still you can register for the course?
Correct. Yeah, you can be AFREhealth member or not. Doesn't matter for us.
Thank you very much, Maeve, for that. So it means that it can be shared widely for others to also join. Gertrude, are you asking a question, or you just, because I see your video on and you are mute, so let me go ahead and give my remarks. First, I want to appreciate UCSF for this wonderful job that has been done. This is our second webinar introducing us to vaccine hesitancy and post-COVID conditions. And as I followed the presentation, I noted that it is not just in Israel, but a whole lot of things are going to be handled under the post-COVID conditions, and it's really very good. And for me, it's something that really going to ask a lot of people to join. I've already posted the link for the training in my LinkedIn. So I just started sharing it because I think it's something that all healthcare workers will need to really have that. Yes, people have been trained on COVID, how to manage patients with COVID, but for post-COVID conditions, I think that the training might not have covered that widely on that. So there's an opportunity that UCSF and AFREhealth is bringing to all of us, and we need to really take advantage of that. If you cannot have access to the LMS, as Maeva said, you can still have access through other means. So I encourage those of us who are on this platform today to share the link with other friends so that they can also register for this course. And then also when you can have access to the LMS, please do join and then have more knowledge in this area. We are very grateful to all of you for also joining. If you've joined and you are not a member of AFREhealth, we want to encourage you to join. These are some of the benefits that individuals, institutions who are members of AFREhealth can really enjoy from being members of our organization. So do join, and also you don't only enjoy it, you can also become a facilitator, because in our programs, we also use it to build your capacity for you to also become a facilitator in some of these programs. So I encourage you all to join AFREhealth if you are not a member. Thank you very much, and over to you, Marietjie.
Thank you very much, Georgina. Let me just say thank you again to all the speakers, Dave, Rand, and Maeve. Thank you very much for the effort you put in and your succinct presentation. And thank you for everybody that attended today. We're very happy that you are here, and we hope you will be able to make use of the opportunities that AFREhealth provides to us. And once again, thank you to Mike and Deborah for being here. You are and will remain great partners. So everybody have a lovely day, and we'll see you next time. Thank you.
Thanks, everyone. Bye.